Tell me a little bit about your situation and how the Affordable Care Act has made an impact.
Sure. Just for a little bit of background, I was diagnosed with severe depression when I was in high school, and I was re-diagnosed with bipolar disorder when I was in college after I had a psychotic episode and was institutionalized and been in some form of psychiatric treatment ever since that time. And so whereas a lot of young people don't have a ton of recurring medical expenses, I have 3 different medications that I take daily, including a mood stabilizer and antidepressant. I have psychiatric checkups that I do once every 3 months. Most periods of time I'll be in therapy, either depending on the severity of what's going on, once a week, once every 2 weeks, once a month, something like that. And if it weren't for the fact that I've been able to stay on my mother's health insurance after I graduated from college, I don't know how I would afford all my different prescriptions. Actually turning 26 on April 22nd, and because of the continuing coverage that's offered, I'm going to be paying to stay on her insurance until I find a job that has benefits. And that's particularly important for someone who has a psychiatric condition because since the pre-existing conditions component of the Affordable Care Act doesn't go into effect until 2014, it's a really tough open market for someone who has the conditions that I have. And so recognizing that and recognizing some of the struggles that other people have gone through trying to look for health insurance, especially as an individual as opposed to being someone who's working, so an individual student, it would be a real struggle. The flexibility that I've had to be able to stay on her plan has allowed me to do a lot more than I would otherwise. Coming to grad school, being able to leave the job I was at previously, being able to take gaps in employment when I wanted to go work on a campaign or whatever it was, I had that flexibility because I had her health insurance that whole time. And now, like looking at the different options that are out there, and I'm coming to the point where I'm turning 26. It really hits you the stark reality of what it would have been like had I got dropped at 24. And so it really, it's made a significant difference in my life. Psychiatric care, if you don't have health insurance, or if you have a plan that's kind of prohibitive against mental illness or mental health issues, it can be outrageously expensive. And then with, like I was saying earlier, the medication element, the mood stabilizer and antidepressant I'm on be quite expensive. So to think of like those expenses, paying for rent and food and room board, whatever it is, I would have had to work full time while I was in grad school, and I probably wouldn't have come back to school. I wouldn't have moved to Arkansas. I'm not from here originally.
So now you're a grad student at the Clinton School of Public Service.
Yes.
What kind of a program of study are you on here?
Okay, I'm getting my master's in public service at the Clinton School of Public Service. I'm in my second year. I'm about to graduate in May, so it's very exciting.
Okay, but you probably would not have been able to come to Arkansas and come to this school had it not...
No, I wouldn't be able to come to Arkansas or come to the Clinton School if it hadn't been for being able to stay on my mom's health insurance, to be honest. It just wouldn't have been financially feasible. And I have all sorts of scholarships to come here. I got a scholarship from the school. I have a Truman Scholarship for public service that I got in undergrad that goes towards grad school, but most scholarships don't cover things like healthcare. So that definitely made a real difference. And now that I'm here, after having been here 2 years, I'm planning on staying in Arkansas, and that never would have happened had I not been able to come to school here. I always think the term Obamacare is kind of hilarious because it does show that people who voted for this act do care about the lives of everyday people, and I think that gets missed with how vehemently opposed people are, and how it's just some people are vehemently opposed to it, and how they demonize this issue. But it's really a human issue. Like, it's very much my life that could have hung in the balance in terms of times where I've had severe depressive episodes, and thankfully I'm in care because with that can come along suicidal ideation and things like that, and I've had people to reach out to. A lot of people don't. A lot of people don't have access to that care, especially adults who've aged out of healthcare or are struggling with mental health issues. Same on the other side of the bipolar spectrum with manic episodes. I have access to an as-needed medication that I can take when that happens, and I don't trip over into psychosis like I did in college. And that it's very dangerous otherwise. So recognizing for me that it's a very personal issue, and I think people try and nationalize it and talk about it as something that's really broad and things like that, and they just don't understand how personal it is to a lot of people. because I'm certainly not the only person that it affects in this way, and not just with mental health issues, with like any type of health issues that you're dealing with, or the fact that it's a tough job market out there right now. So a lot of students aren't able to get jobs right out of college. So where are they going to get benefits from? And it, especially with the fact that if students are using like emergency care as primary health care, like that's much more expensive than something like the Affordable Care Act is. And I think that those dynamics are things that are missing from the debate because it becomes so demonized and so just such a screaming match, as opposed to a reasonable conversation about the effect this has in day-to-day life. Especially, and I mean, like being able to stay on my parents' healthcare, my mom's healthcare was one thing, but being able to know that, at least in 2014, I don't have to worry about my conditions as pre-existing conditions, that was a huge relief to me. I know it's a major concern for people dealing with mental health issues, because it's only been in recent years that mental health parity has really come into play, and then this is really just that next step. And so to say that it's socialized medicine or something that is like a government takeover of healthcare, it just flat out isn't true. It's just providing opportunity to people who wouldn't have access to these things otherwise.